Good afternoon. Thank you so much for joining our Public Health Career Changers info session panel discussion today. We're super happy to have you join us. We've got a packed agenda and we've got lots of people to hear from, so we're going to get going. Just a few quick housekeeping notes I added in the chat box that's where you want to ask questions throughout the presentation. And we are recording this presentation, so we will share it with everyone who has RSVP'd and joined us today. So you will be able to see the presentation and the slides afterwards. So we're going to go over quick introductions, and then we're going to get right into the conversation with our alumni and hear about their journey to public health. And we're also going to learn more career opportunities in public health. And we're going to hear from our career advisor, Heather Palow, and our student support services professional, Vika Bleshikova, about the services that surround our MPH students as well. And you'll learn more about our MPH program here at the University of Vermont. We're super happy to have you here. My name is Nicole Willier-Fenton. I work in our continuing and distance education department. We have Tori with us. Tori is a recent graduate from our MPH program. We're going to learn a lot more about her path in public health. So Tori, we'll hear from you in just a moment. And Jillian also joins us. Jillian, we're so happy to have you, also a recent graduate from our MPH program. And I'm pretty sure she's continuing her education as well. So we're going to hear about her path and her continued path in the career of public health. And I mentioned Vika is with us right now. She works so closely with our MPH students, and Vika will be answering questions in the chat box, and we'll hear more from Vika as we dive a little bit into the program towards the end. And Heather is also with us. Heather works so closely with our students as they're starting to explore what kind of career do they want in public health. And one of the bonuses of UVM's public health program is you continue to work with Heather as an alumni of the program. So as you continue on your public health career journey, Heather is there to support you. So we're going to hear about her services that she does with our students. But first, I wanted to pause the presentation for a moment, and we're going to go to a video. Dr. Jan Carney is the head of our program at UVM Larner College of Medicine in our public health program, and she has quite the credentials. She was the Commissioner of Health in the state of Vermont for many, many years, and she leads our public health program. And so Dr. Carney, this is a short video in which Dr. Carney talks about the opportunities in public health and the need for people in public health. So I'm just going to ask all our presenters to turn off their cameras. This gives us an opportunity to play the video full screen, so you have the best viewing opportunity. But stick with us. Right after the video, we're going to hear from our alumni. So we'll be right back.
A degree in public health gives you tremendous potential and different opportunities to practice public health. You can do research in universities. You can work for community not-for-profit organizations that are very involved in improving the health of the community in different ways, whether it's actual health care or social determinants of health, such as providing food security or housing. Many, many different opportunities. You can have a career in a government public health agency. What does that look like? Every state has a state health department. They have county and local health departments. There's a whole federal oversight through the CDC and other federal agencies involved in public health. You can work for any of those. And you can work in a variety of different topics. You can work in preventing infectious disease outbreaks, epidemiologists, the disease detectives. You can work to prevent chronic conditions. You can help people quit smoking. You can work on preventing environmental contamination and health harms from that. You can work to help people access health care and community and social services. There are so many different opportunities in public health depending on your area of interest.
I'm going to have our presenters come back in and join us. I just wanted to share that video because Dr. Carney has seen a lot in public health. And one of the things about our program is our faculty have worked in public health, are experts in public health, and many of our faculty are part-time because they're still working in public health in the field right now as well. So that's the kind of expertise that our students learn from. And so here's another slide just touching on some of the things that Dr. Carney was talking about and opportunities for careers in public health. But let's turn to our alumni. Let's turn to our alumni because that's really who we want to hear from today, your journeys. And so I want to start with Tori. Tori, let's just make sure your microphone is turned on and tell us your journey to public health. What position are you in now and how did you get there?
Sure. So thanks for having me and getting to share a little bit about the journey. I am currently the lead COVID investigator and contact tracer for the Maine Tribal Nations. That's through the COVID-19 Corps with the CDC Foundation. I started that position last August after a tumultuous interviewing process that Heather graciously held my hand through the entire way. And it's been a thrill to be in the position now. I started because I found myself landing in jobs that were on the periphery of public health. And so when I was looking at jobs that I wanted to transfer into or that I wanted to eventually achieve, they all came with this additional MPH requirement. And so that was really what started my graduate journey, really.
About the work you're doing right now, Tori. Describe the audience that you're working with and how many people, and you're also remote too with the population you're working with in Maine. So give us a glimpse as to what is it like in the job that you're in.
It's COVID. So it's like we've got a bunch of things going. I think I started in nonprofits, and there was a saying that I picked up when I was at Vermont Works for Women, which is that nonprofits are able to be kayaks and they're able to pivot very quickly as opposed to the federal cruise ships that take a long time to make those turns. So my days are a lot of pivoting to the needs of what's arising during that time. I am serving the 5 tribal nations, so Micmac, Passamaquoddy, Maliseet, and Penobscot. There's 2 tribal governments under the Passamaquoddy tribe. There's about an 8,000 person population in the state of tribal members, or these are registered tribal members. And I serve under a consortium of the health directors from each one of those tribes. So we as the team, I've been able to hire tribal members from each one of the tribes as contact tracers, and we handle whatever COVID cases or contacts are arising and work with the tribes more broadly to try to think about emergency preparedness or other communication efforts that we can also be putting out.
The forefront of it. Thank you so much for the work that you're doing. That sounds really fascinating and flexible, right? You have to be really flexible to navigate that, I'm sure. Jillian, let's hear from you. Different side of public health. I think you dip your toe into a little bit of what Tori was talking about, but tell us about the role you're in now and your journey to a career in public health as well.
Yeah, so right now I work for the Alcohol and Drug Abuse Program at the state of Vermont, at the Department of Health. But I definitely, a lot of accidentally falling into interesting jobs happened to me to get there. So I started out as a laboratory scientist. I had a deep love of microbiology. And I went to UVM as an undergrad and worked with someone who's no longer there, who has retired, but he was really passionate about public health. And really encouraged me to get a job at the state of Vermont Public Health Laboratory when I graduated. So that's sort of how I started moving towards public health. I was like, yeah, this sounds cool, but I'm going to stay in the lab. I really like discovering what bacteria people have in their poop. It's real fun. But as I got more into that, I discovered I wanted to know the stories behind why people had these diseases and why individuals were getting this and not other folks. So I an opportunity kind of came to me and I moved into infectious disease epidemiology at the state of Vermont. And at the same time, I realized that I wanted to advance my career in public health. I didn't want to stay in the lab anymore because I wanted to sort of talk to more people and investigate less bacteria. So I decided to take apply to UVM's program and start that while working full time. So I became an infectious disease epidemiologist with vector-borne and STI programs. And then after 2 years of that, I wanted to get more evaluation experience. So I switched into ADAP, which is alcohol and drug abuse, working on programs there to determine whether or not they're successful. But unfortunately, my infectious disease background got me pulled right back into COVID about 8 months into that job. So I was leading Vermont's team, or one of the co-leads on Vermont's team for the outbreak investigation. So any facility that had a person with COVID in it, I was calling them or leading a team to call those places. So that's been my career journey. And I think Nicole alluded to it before, but I also have a passion for clinical work. So I, on a whim, applied to UVM's DNP program. I've been a volunteer EMT for 6 years. So been balancing this sort of data analyst and clinician roles for a long time, and the clinician finally went out. But I'm really excited to continue my public health work as a clinician. My dream would be to do evaluation and clinical work, sort of 50-50. But we'll see if that happens. And I'm starting in August. So.
That sounds amazing. Congratulations. I know that we were talking about that when we spoke a few weeks ago as well. So that sounds awesome. And thank you for pivoting your skill set to support the state during the pandemic. Sounds like both of you are so key in the support that Vermonters and in tribal nations in Maine received over the last year and a half. So I want to touch on something, and Jillian, I'm going to stick with you for a second, and then Tori, I want to come to you as well. Working full-time and getting your MPH. How did you do that? How did you manage the program? And because I'm sure folks joining us, maybe, and I'd love to hear in the chat box of any of our participants, is this a program that you would be doing while working full-time, part-time? How would you manage this? And so from our alumni, how did you manage schoolwork and working at the same time?
Yeah, so I was working at first at the lab and then moving into infectious disease while doing this program. And I found part of the reason that I wanted to do this program in particular was because it was online and very flexible. So I could work around it. I do overnight shifts as an EMT and I work during the days. So I have a pretty busy schedule, but I was able to fit in a lot of the classwork. I did about 2 classes each semester, which worked out really well for me. I don't have a family, so that's like a plus side, but I found that the professors were really understanding. I actually worked with a lot of them at the health department. And I also had a really good community at the health department to help me with my MPH as well. So, I mean, I think that I was really lucky in my work community to support me through working during the MPH, but I also found that all the professors were very understanding as well. So
that time and time again. And Tori, I'd love to hear about your experience. How did you navigate those waters and how did you fit it all in as well?
It's definitely a lift. Grad school full-time is not the same as, an undergraduate program full-time, and working full-time on top of that. It is time management is definitely something that you will get used to owning. But I think it's definitely doable. I think I totally would echo everything Jillian said, is that the professors, the faculty of the program feel very accessible and totally realistic. They are also working professionals, and they understand what you're doing or what you might be trying to balance. And I think there's a fairly good mix, or at least in my cohort, there's a good mix of those of us who were working full-time and taking the program full-time, and others who had maybe dropped down to part-time and were still working, or just in the program full-time. There's a good, so you're able to connect with different peers at different opportunities. I do just have to shout out Vika, because I was working full-time and going to grad school full-time and trying to plan a wedding. And Vika said, hey, I know this is not in the timeline that you want, but I think we really need to drop you down to part-time this semester, which was the spring semester before my summer wedding. And I was angsty and all like not sure if that was a good idea. And my word, Vika saved my wedding and saved my academic career, because just knowing that expertise of having to slow it down just for one semester, and it did not affect my graduation date. It was a very helpful insight and saved my sanity. So thank you for that wisdom, Vika.
And that's a testament to the closeness and the support that our students receive from both Vika and Heather. So that's awesome. Thank you for sharing that story. And Vika, thank you for being so amazing too. Yeah. So I want to pause just for a moment from our alumni who are with us here, and we're going to go to another video. I wanted to share this video. Emily Belanger, she just graduated, I think in spring, in May, and I love hearing her story as well, because she also has a unique path to public health. And one of the things that I think is fascinating is she went from being a wine expert to public health. So how do you make the journey from hospitality into public health? So we're going to pause our speaker cameras here for just a moment. We're going to hear this video from Emily, and then we'll be right back to continue the conversation.
When I was an undergraduate at Amherst College, I was bouncing between areas of interest. I was pretty much a biology and history double major, and my advisor was the history of science was his specialty, and having him as an advisor guided me in my sort of interest. And I wrote my senior thesis was included the foundations and the beginnings of public health in America and public health education and the start of Johns Hopkins. So as somebody who likes intersectional disciplines and was kind of that like historian research mind, the importance of public health was really like emphasized to me. And it definitely stuck with me. It was always something that I was like, public health is this field where it's like you need to be versed and comfortable in the sciences, but it's so much more about communication and understanding bigger pictures. And so from my undergraduate experience, I carried a lot of that interest. Then after I left Amherst, I moved to Vermont. I was working museums, and then I moved into wine, which is also very interdisciplinary in its own way. It's a combination of science and culture. And I decided at some point, I want to go back to school, and only through sort of living through my 20s did I understand the importance of something that was driven home a lot during the course of my MPH, which is that this is essentially a degree that focuses a lot on social equity and understanding the social determinants of health. And those became so much more important to me just living and working in Vermont that I said, okay, I have the sort of academic interest already, and then I have the sort of human interest, and it really aligned with a lot of my values and goals. So I was like, this is the time, let's do it.
So great to hear from another one of our alumni. It's often a really unique journey that I think a lot of our students take. And so from our participants, I'd love to have you, if you feel comfortable, put in the chat box what is your current position? Is it something in public health? Are you thinking of switching careers or advancing in public health? We'd love to see where you're at and what your potential journey is to a career in public health. And please, if you have any questions as well for our presenters, Tori and Jillian, and we're going to hear from Heather and Vika more as well. So speaking of that, let's jump in with Heather. And so Heather, you work so closely with our students as they're starting to think about, where am I going to go? What do I want to do in public health? And after they graduate, there's always an opportunity to continue to work with you. So Heather, just walk us through, what are some of the services and support that you provide for our students?
Sure. When we first start working with our students, I meet with them during the orientation, and I share from the very beginning that we walk hand in hand and hear where you're at in your current career. If you have a career, if you're an undergrad going right into your master's degree, what does that look like for you? Do you have experience? I'd love to hear how you're doing on your path to career public health activities in the orientation process. And then we hear, do you have your resume, cover letter, documents, LinkedIn profile, all of those things that help set you up as a professional. So if you do not have those documents, or if they're in rough shape, or wherever you're at with them, I work with all the students to get yourself ready to go so that you can talk to internship programs, you can talk to professionals, and have those networking conversations. So throughout the program, you can do that. And then as you turn into an alumni and graduate the program, I work with everyone, even through the salary negotiation process and interview process, and what does it mean to do informational interviews, and all of those different activities are things that I work with students, and then into being an alumni. So throughout the time that you're there in the program, and then as you transition, so that we can make sure and support you. And as the alumni today have talked about, so many people are in such different areas of public health, and what does it mean to work with different populations? And so there's so many different career choices. And then as you think about different populations, and then do you want to work in a lab? Do you want to work in a hospital? Do you want to work with individuals or large organizations and large groups of people? So as people are deciding where they want to go and who they want to work with, all those questions are things that I work one-on-one with students to answer. And through one-on-one meetings, or we can talk through webinars, we can talk through different chats, looking on LinkedIn. I also help match alumni together. So our students are all over the country and all over different places. And so sometimes someone says, I'm in this location and I'm going to this location, or I would like to work in a hospital, or I would like to work in this other location. Can you connect me to some alumni? So all of these things are areas and services that I help support our students to navigate the career journey so that they're successful as they decide what they want to do in the world of public health.
We already have Maggie ready to work with you. So, so Maggie, thank you.
I love it.
Yeah, that sounds great. And thank you, Heather. There's so much. That's just a sneak peek. I know you do so much with students and alumni. So thank you for giving a quick overview. And if you have any questions for Heather, please let us know. But I want to come back to a question that Maggie has. And I want, Tori and Jillian, I want you both to think about this. Is it common across cohorts that students are also working full time? To what Tori mentioned, if it does become too much, how easy is it to switch between full and part-time if needed? And I know that Vika said that it's very flexible. So maybe Vika, why don't you expand on that? And then Tori talked about it, but maybe Jillian, how did you adjust if you needed to as well, or did you feel comfortable? We'll start with Vika.
Yes, most of our students do work full-time. We do have some students who are completing their undergraduate degree when they start taking the public health courses. They're in accelerated MPH, and that would be the only audience I would say that is taking courses full-time without a side job. But for our students who have families, who have full-time jobs, the program is totally flexible. You can take as many or as few courses as you'd like per semester, as long as you graduate within 5 years. And that's when, in the beginning, when I meet with the students, we go over the course plan, we determine which classes you're going to take when. There is no particular sequence in which you take courses, with a few exceptions. But we plan ahead, and we know if the students are occupied, then I would say, okay, let's just stick to 2 courses per semester, for example, and then maybe 1 or 2 in the summer. So we take all of that into consideration. And even if we do come up with a plan, it's not set in stone. We can change it as we go And as you start taking the program, you will probably be, you will see what it's like to be taking these online graduate level courses, and realize your potential, and we can take it from there.
Response. Jillian, I just would love to hear from you too. How many courses did you take? You were working full time, you were volunteering as an EMT, and I know you mentioned that, you know, family and children wasn't a factor, but you still had a lot going on. What was your course load like, and did you ever have to shift that at all?
Yeah, so actually I started my first semester with one course because I just wanted to like see, I hadn't been in school in a while, and I just wanted to like get a sense of what it would be like working. And then went up to two, and like I think there was one semester that I did three, which was great, but it's like, it's all, I'm just going to echo what Vika said, it's all very flexible. I actually then had a head injury at the very end of my public health career and had to push my graduation date back, and like worked with professors to like complete, because I couldn't be on screen. So it was this whole thing, and everyone was so wonderful and like really worked closely with me to like figure out the best way to manage that. And it like wasn't it wasn't hard, even for someone who like couldn't focus super well. So
Oh
yeah.
my goodness. I'm sorry that you went through that, and I'm so glad to see that you've recovered. So,
Yeah.
and thank you for sharing that
Mhm.
perspective. I want to come back to a question too, and I think, Heather, you get this question a lot about how do I volunteer in my community? How do I add experience? And so the question really is about interested in how I could leverage this experience of expertise, current expertise, and effectively volunteer in my community. I'm currently serving as an affordable housing committee and wish I had public health point of view to approach this work. Any thoughts on what advice you might give?
Quite often we ask students what their passions are and what areas that they care about, and then where they want to go. So if you have an area of public health that you have never experienced before but you're interested in, we have so many faculty who have areas of expertise that we can match you with to talk through what are some opportunities in that area of, you know, if it's global health, if it's environmental health, if there's working in a nonprofit setting, if it's working in, you know, and working with a certain type of employer, and say what type of internship opportunities are available within those different sectors, and sort of navigate that conversation with different people. And so if we need to set up an information interview with a certain faculty member, with a certain community member, to really understand what type of internships are available, describing, you know, what type of positions might be available with that certain employer, those are all things that we can do to help support how you go about learning about that area of public health and that different population of people. You know, as I mentioned, we have so many alumni in so many different areas as well. So sometimes it's a conversation with other past students to say, what type of job do you have and what type of work do you do? And these volunteer opportunities are very formal sometimes with, you know, certain agreements. We have a course that has some volunteer components to it. And it also can be informal, just getting to know different organizations. So there's lots of different opportunities that we can share to help you learn about different parts of volunteering and different parts of public health.
Great. Thank you. Hopefully, Sergey, that answered your question. And if you have any follow-up questions, we'd be happy to answer those as well. We've been talking a lot about the program, and so I just wanted to put up a bit of information here. Just what does that look like in terms of credits, and also the areas of focus, what Dr. Carney always calls the areas of excellence, and where our program focuses. And so I want to just come back to Vika for a moment. It sounds like there might be some people with us today that are interested in this program, or know somebody that's interested as well. So sharing that information, we would love you to do that also. So how do people get in? What do we need to consider to get into UVM's MPH program? Vika?
I would say our application process is fairly easy. We do not require any standardized tests, so no GREs or GMATs are required. What we're looking for from the students is a bachelor's degree with a 3.0 GPA and a background, at least one course in math statistics and a basic understanding of science. And the reason we're looking for math or statistics is because you will be doing some highly quantitative courses like epidemiology and biostatistics, and we want to make sure that you will be prepared for that. If you don't necessarily have those courses under your belt, but you have had some work experience, for example, we can still review your application and make a decision on the individual basis, or make recommendations of whether or not you will need to complete that course. So the application is online through the graduate admissions office, $65 fee, personal statement, and we will review your application with unofficial transcripts. At some point you do have to submit your official ones, but as we're approaching our deadline of August 1st for the full semester, I would say you can submit your application, and as long as we have it, we will wait for the rest of the documents to come in. 3 letters of recommendation are usually advisable, and all official transcripts at some point. We are accepting fall applications right now until August 1st, and then we will accept students on a rolling basis as long as we have space in courses. And here you can see that we are accepting students 3 times a year. You can start in any term, fall, spring, or summer. And as I said, we will customize the plan based on when you start. And it is possible for the students to finish it within 15 months for those students who start in the summer only. But most of our students complete the program within 2 to 3 years, I would say. Right. Out-of-state students pay differentiated tuition. That means you pay less per credit than typical UVM undergraduate student does. You pay $927 per credit versus almost $1,700. And the Vermont tuition is the same across the board for Vermont residents. There are loans available for students who fill out FAFSA, and if you qualify, you need to be enrolled in at least 2 courses per semester to get federal loans. And I'll be happy to answer any questions and chat as well about that.
Awesome. Thank you so much. And why don't you just stick with us here, Vika, for a second. Mm-hmm. Online classes, in person, or combination. This program is 100% online. Do you want to just share a little bit more about that for Dagmar?
Sure. All of our courses are entirely online, and they are offered in an asynchronous format, which means you do the work on your own time. There might be a few exceptions when the instructors will have speakers come to the courses, but those are recorded, so you don't have to be present or logged in at a certain time. So time management is really important here, because you do have to be disciplined in order to stay on track. And there are weekly modules that are released for the courses. So you do have to do the work on your own time, but of course you will have deadlines for assignments.
Sounds good. Thank you so much. Hopefully that answers that question. But Maggie is also asking, and I know we get this a lot, do the letters of recommendation need to be from somebody specific in the science field? What is the parameters for those letters?
It's as long as it's not a family member or a friend. It can be anybody. It can be a mentor. It can be a supervisor. Doesn't necessarily have to be somebody from the academic background, because we know that some students left college a few years ago, so they don't have any way to contact those previous instructors. So that's totally fine.
Great. And then also another question from Sarah Jane. Can you address any limitations on transferring credits into the program? So if she starts taking a few classes, what can then lead into the program as transfer?
Sure. We accept up to 9 credits into the program, which means you can take 3 graduate level public health courses before you can apply to the program and transfer them. If those courses are taken at UVM, you can transfer up to 12 credits, which means you can take 4 courses here as an undergraduate student and then apply to MPH and have them transferred. You do have to get a grade of B or above, and if the courses are taken somewhere else, we do need to look at the syllabus and have them approved by Dr. Carney.
Great. So sounds like, Sarah Jane, there's some flexibility in there as you navigate waters with your family and your job. So, and Vika is very much there to help you. So I want to just give another plug. If there's any additional questions, please do put those in the chat box, because we're going to near our time here in the next couple of minutes. But I wanted to come back, Tori, let's come back to you, and then Jillian will round out with you as well. But Tori, how well did you feel prepared for the work that you're doing? We talked about the program and the support that Vika and obviously supported you in guiding as you were juggling a lot. How did the knowledge and the foundational knowledge support you in your path to public health?
I think Emily mentioned it in her video, but the things that I think are so core to this program is the emphasis on epidemiology and biostatistics. So you really do have a strong vein of purely public health concentration in there. But then it's broad enough that you get to explore like the peripheral public health, everything that exists through electives or your required courses. And all of it has an emphasis on equity and the social determinants of health. And I think if there's two things that I took away from this program the most and incorporated into what I'm doing now, it is having like cultural competency in the sense that like I know health equity needs to be number one in how we're visioning and how we're working and how we're strategizing. And we can use the social determinants of health to like gauge where we are in that as well. So I think those two core tenets of the program I don't know how to quite absorb it, but you pick it up, it's emphasized in every single course. And it becomes, I think it's critical to being a successful public health professional, honestly.
Great. Yeah. And in that interview with Emily, she seconded that as well. She talked a lot about really having a core understanding and lens of social determinants thanks to this program.
Right, exactly.
Jillian, we'd love to, yeah, thank you, Tori. Thank you so much for your perspective. Jillian, we'd love to hear from you. You've been in science and health, but the journey that you've taken, how did this program prepare you for that?
Yeah, so I would 100% echo Tori when it comes to equity and social determinants of health. That wasn't something that I had necessarily in my lab career thought about, worked with as much. I mean, probably should have, but just wasn't taught as much in those courses. So the public health program definitely opened my eyes to that and was really wonderful. I think definitely the data side for me was really helpful. That between like there aren't that many cases of like vector-borne or STI in Vermont, so like complex statistical knowledge isn't necessarily needed, but like when I moved into ADAP, understanding evaluation was really important, and different statistical methods was really important, and I think that the MPH prepared me well for that.
Great. Thank you so much. And I see Maggie is typing a question, so we'll give you just a minute to ask that question so we can get to it before we are done. Oh, great. There we go. As far as getting a job after graduation, seems like both Tori and Jillian were already somewhat involved in public health. Do you find that students coming from another career are able to somewhat easily find positions in the field after graduation? Heather, do you want to answer that question for Maggie? And I think Emily is a great example too, coming from hospitality. She is actively working in public health and seeking new opportunities right now too. She's kind of, testing the waters and seeing where she wants to go. But how do students navigate the real stark transition from non-public health into public health careers?
Sure. We have students from all walks of life. We have students who've owned restaurants. We have students who have done all sorts of different activities. And, the thing that I find, most students have an area of public health that they're interested in. And, between doing internships, between talking to alumni, between hearing about areas that they care about, they start to find a passion, usually somewhere between their first year and their second year. And so they're finding, jobs that they might be interested in applying to, people that are interested in the same passions that they're interested in, even going to, online lectures and learning about, webinars and things that they can start to see some trends happening. And by doing that, they're starting to say, oh, could I see myself as X type of professional? Could I see myself, associating with that professional organization? And through hearing and seeing those things, you start to see, oh, I could actually do that job. I could actually be part of that community. I could do something with that population of people. And, those activities help you to understand that that could be a job that you might want to apply for. If you have never done anything like that, then I highly suggest doing an internship, even if it's 10 or 20 hours, just to see, could I be part of that community? Could I be part of that internship and experience? And I understand people working who are doing lots of other things, but volunteering is such an integral part of public health. Gives you a chance to try out a population before you actually commit to being in that in that environment, whatever that environment looks like for you. So quite often people transition that way. If you've never done working in a hospital environment, you can do some different, so all of these things are ways that students have tried out a career. I use that kind of in quotes, trying out something before they actually transition to it 100% in a full-time employment capacity. So these are examples of things that we help our students do. You can certainly connect with other people in your network who have done that before, and talk with us, and we can share the experiences that other people have done who've transitioned from one area to another. Emily is a great example who had some, a passion for something, but didn't really know how to navigate that. And so she was trying to figure out where to go next. And so we connected with her with some resources. So all of these things are ways that people can find positions. And so many of the skills that you've done in other careers are things that absolutely transfer to a public health career, and just helping you think through that and go, absolutely, I use communication skills, I use public speaking skills, I use lots of these different skills in the world of public health. I just didn't really think of it through that lens. So these are conversations I have with students quite often, and help you to write out your documents and whatnot to help you have that public health purview while you're still transferring your skills from your past career.
Great, thank you. And Tori, did you want to add something to that?
The only thing that I've pivoted twice in careers. And so the only thing that I was going to give a suggestion for Maggie is, if you start to think about the intersection that you want to be at, that becomes your tagline. And what I mean by intersection is, at the very beginning of the program, exactly as Heather's talking about, they'll ask you, what are you passionate? What are you thinking about? And for me with this program, it was, I want to be at the intersection of humans, technology, and public health. I didn't know what that looked like, but I just knew that those were my interests. And so I wanted them to all intersect within this program. And I've definitely been successful in that. And so I think if you start thinking about what core bits do you want to make sure you move towards, it can help fuel you, and it can help provide that language when you're trying to communicate, but not really quite sure like what a job title might be.
Great. Such great advice. And I know Jillian had commented for Maggie earlier that we need more tech folks in public health. And so we really appreciate that perspective as well.
Nicole, can I just
Please,
add one
yeah.
really quick thing? The other thing that I found really helpful when I was moving or choosing whether or not, or thinking about whether or not to become a clinician as well, I did a lot of buying people coffee or bringing them snacks and asking them to tell me about their career paths. Or like, I saw that they posted a really interesting job and I'm not qualified for it yet, but I love to hear about it. And like, just sort of like networking, getting yourself on people's radars, but also like learning, because you can talk to someone and be like, no, I definitely don't want to do that. So I think that was like a really fun way to meet people, but also like get a sense of what you want to do.
Awesome. Thank you both, Tori and Jillian, for that perspective. And I know Heather encourages people to do that as well. So you get so much support surrounding you in our program on your journey to a career in public health. Thank you, Maggie. Thank you, Sarah Jane, for all the great questions, Dagmar as well. And thank you, Vika, Heather, Jillian, and Tori, and our team and the behind the scenes making this info session possible today. So if you have any additional questions, please reach out to us at learn@uvm.edu. And also I do have, we zip it right back up here, specific public health email as well. So public.health@uvm.edu. And if you have any other questions, we'll be happy to answer them. So thank you very much for your time, everybody. We wish you a wonderful afternoon. Take care.